Did you know that your feet might be sending you urgent warnings about your health right now? It's true. The average 70-year-old has walked over 100,000 miles in their lifetime, and those hard-working feet can reveal serious health problems before other symptoms appear. Today, I'm sharing 7 critical foot changes that could signal dangerous conditions requiring immediate medical attention. Shockingly, over 30% of seniors miss these warning signs until it's too late. The third sign on our list, even doctors sometimes overlook it, and that mistake can lead to amputation, stroke, or worse. Stay with me through this entire video. Recognizing these warning signs could literally save your life or the life of someone you love. Welcome back to Life Advice for Older People, where we provide crucial information to help you live your best life after 70. Today, we're diving into something vitally important that most health channels never discuss: how your feet can reveal dangerous health problems. Meet Howard, a 73-year-old retired teacher who nearly lost his leg last year. For months, he ignored a small discoloration on his foot, thinking it was just normal aging. When he finally saw a doctor, they discovered advanced peripheral arterial disease that had nearly cut off circulation to his foot. After emergency surgery and months of rehabilitation, Howard now checks his feet daily and wants others to learn from his experience. Howard's story isn't unique. Studies show that foot changes are often the first warning sign of serious conditions like diabetes, heart disease, and circulatory problems, yet most people don't know what to look for. Today, I'll walk you through the 7 most critical foot changes that should send you straight to your doctor. Some might seem minor, but ignoring them could lead to devastating consequences. Have you noticed any changes in your feet recently? Drop a comment below and let me know if you've ever connected foot symptoms to other health issues. Now let's get into these 7 crucial warning signs, starting with one of the most common but frequently overlooked changes. Number 1. Numbness and loss of sensation. The first critical foot change to watch for after 70 is numbness or loss of sensation in your feet. You might notice you can't feel temperature changes, or perhaps walking feels like you're stepping on cotton. This isn't just an inconvenience, it's your body sending a serious alarm signal. Diabetic neuropathy is one of the most common causes of foot numbness in older adults. When blood sugar levels remain high over time, they can damage the nerves in your extremities, particularly in your feet. What makes this especially dangerous is that without proper sensation, you might not notice cuts, blisters, or injuries that can become infected. Howard, whom I mentioned earlier, experienced this exact problem. He stepped on a small tack, but never felt it because of the numbness in his foot. The resulting wound became infected, which was the first event that ultimately led to his medical emergency. Have you ever experienced strange tingling or numbness in your feet? Or maybe you've noticed you can't feel temperature changes as well as you once did? Tell me about it in the comments below. Here's what makes foot numbness particularly concerning. Research shows that about 50% of people with diabetes develop neuropathy, and many have diabetes for years before being diagnosed. Your feet might be the first place showing symptoms of a disease you don't even know you have. Warning signs that your foot numbness needs immediate medical attention include numbness that appears suddenly, loss of sensation that spreads up your legs, numbness accompanied by sores that don't heal, and inability to feel temperature changes in your feet. If you experience any of these symptoms, don't wait, contact your doctor right away. Early intervention can prevent serious complications, including amputation. Proper foot care, including daily inspection for injuries, becomes essential when dealing with numbness. But here's what many doctors don't tell you. Numbness isn't always related to diabetes. It can also signal B12 deficiency, peripheral arterial disease, or even early signs of a neurological condition. That's why professional evaluation is crucial rather than self-diagnosis. The good news, treatments are available, especially when caught early. From medication to specialized footwear and physical therapy, there are ways to manage numbness and prevent its complications. Remember, your feet contain over 8,000 nerves, and they're trying to communicate with you. When they go silent through numbness, That's not a blessing, but a warning you should never ignore. Number 2. Persistent swelling. The second dangerous foot change to watch for after 70 is persistent swelling, especially when it occurs in both feet. While occasional swelling after long periods of standing or sitting is normal, persistent swelling is your body signaling that something needs attention. Take the case of Sylvia, a 76-year-old grandmother who noticed her shoes feeling tighter each day. She dismissed it as weight gain until her daughter visited and was alarmed by the significant swelling in both her feet and ankles. A doctor's visit revealed Sylvia was suffering from congestive heart failure. Her heart wasn't pumping efficiently, causing fluid to build up in her lower extremities. Foot and ankle swelling, medically known as edema, often indicates that your circulatory system is struggling. When your heart can't pump blood effectively throughout your body, fluid can accumulate in your feet and ankles due to gravity. This is why swelling typically worsens as the day progresses and may improve somewhat after elevating your feet at night. Have you noticed your shoes fitting differently at the end of the day, or imprints from your socks on your ankles? These can be early signs of swelling that you might not immediately recognize. Share your experience in the comments. What makes persistent swelling particularly concerning are its potential causes. Heart failure or weakened heart function, kidney disease which affects fluid regulation, liver problems, particularly conditions like cirrhosis, venous insufficiency, where veins can't properly return blood to the heart, and medication side effects, especially from blood pressure medications, steroids, or certain diabetes drugs. The key difference between normal swelling and concerning swelling is persistence and context. Swelling that doesn't improve with elevation occurs upon waking in the morning or is accompanied by shortness of breath, requires immediate medical attention. Here's a simple test. Press your finger into the swollen area for 5 seconds. If the indentation remains after you remove your finger, called pitting edema, this suggests fluid retention that should be evaluated by a healthcare provider. The good news is that addressing the underlying cause often improves the swelling. Treatments might include diuretics to remove excess fluid, compression stockings to improve circulation, dietary changes to reduce sodium intake, or medication adjustments. But don't wait for swelling to become severe before seeking help. Early intervention can prevent complications and more serious health crises. If you're learning something new from this video, please hit that like button. It helps others find this important information too. Remember, your feet are the foundation of your mobility and independence. Persistent swelling isn't just uncomfortable, it's your body sending an urgent message about your cardiovascular health that deserves your prompt attention. The third foot change you must never ignore, and the one that's often missed even by healthcare professionals, is discoloration or color changes in your feet. This seemingly simple symptom can signal life-threatening conditions that require immediate medical intervention. Consider the story of Philip, an active 72-year-old who noticed his right foot turning pale white whenever he exercised, then becoming unnaturally red when he sat down. He mentioned it casually during a routine checkup, but his doctor initially dismissed it as normal aging. 3 weeks later, Philip experienced excruciating pain and was rushed to the emergency room, where doctors discovered a dangerous arterial blockage that nearly resulted in gangrene. Emergency surgery saved his foot, but his recovery took months. Have you ever noticed your feet changing color, especially when changing positions or during certain activities? This information could be vital. Share your experiences in the comments section. Here's why foot discoloration is so dangerous. It often indicates serious circulatory problems that can lead to tissue death if left untreated. Different colors signal different potential problems. Pale or white feet may indicate arterial insufficiency. Blood isn't reaching your feet properly due to narrowed or blocked arteries. Blue or purple discoloration, cyanosis, suggests oxygen-poor blood and can signal heart or lung problems. Dark red or purplish feet that turn pale when elevated might indicate venous insufficiency. Black or dark spots can be signs of tissue death, gangrene, requiring emergency treatment. A single toe turning blue or black could indicate a blood clot. What makes these colour changes particularly alarming is that they're often painless in the early stages, especially in those with diabetic neuropathy who have reduced sensation. By the time pain develops, significant damage may have already occurred. Peripheral arterial disease, PAD, is one of the most common and dangerous causes of foot discoloration, affecting over 20% of adults over 70. But here's what's truly frightening. Having PAD increases your risk of heart attack and stroke by 5 to 6 times. That discoloured foot isn't just warning you about limb health, it's warning you about your cardiac health as well. The diagnostic process for circulation-related discoloration typically involves non-invasive tests like ankle brachial index measurements, which compare blood pressure in your arms and ankles. More advanced testing may include ultrasound or angiography to visualize blood flow. Treatment options depend on the underlying cause, but may include medications to improve circulation, lifestyle changes, particularly smoking cessation, interventional procedures to open blocked arteries, in severe cases, surgical bypass to restore blood flow. Remember, your feet are the furthest parts of your body from your heart, making them excellent early warning systems for circulatory problems. Any persistent change in foot colour warrants medical attention. It could quite literally save your life or limb. The fourth critical foot change after 70 involves your toenails. While many dismiss toenail changes as merely cosmetic concerns, they can actually signal systemic health problems requiring medical attention. Let me tell you about Georgia, a 75-year-old who noticed her toenails becoming increasingly thick, yellow and brittle. She assumed it was simply part of aging until a podiatrist recognized it as a fungal infection combined with signs of psoriasis, which was causing inflammation throughout her body. Treatment not only improved her toenails, but reduced her overall pain and fatigue. Toenail changes are often overlooked because they happen gradually and rarely cause pain initially. However, they can reveal important information about your circulation, immune system, and overall health. Have your toenails changed in appearance, thickness, or color over the years? Many people notice changes but don't realize they could indicate health concerns. Share your observations in the comments. Here are the concerning toenail changes you shouldn't ignore. 1. Thickening toenails. While often attributed to fungal infections, persistently thickening nails can also indicate poor circulation, psoriasis, or reactions to certain medications. When combined with discoloration, thickened nails may signal diabetes-related circulation problems. 1. Yellow or brown discoloration. Beyond fungal infections, persistent discoloration can indicate lymphedema, respiratory conditions, or even thyroid disorders. Yellow nail syndrome, though rare, is associated with respiratory and lymphatic system issues. 1. White spots or lines. These might indicate mineral deficiencies, particularly zinc or calcium, which are essential for proper nerve and muscle function. In seniors, these deficiencies can contribute to balance problems and increased fall risk. 1. Clubbing. When toenails curve downward and the tips of the toes enlarge, it can signal chronic oxygen deprivation, potentially from heart or lung disease. This change develops over time and is easy to miss without careful observation. 1. Spoon-shaped nails, koilonychia. Nails that develop a concave shape like a spoon often indicate iron deficiency anemia, which can cause fatigue, weakness, and cognitive issues that many mistakenly attribute to just getting older. What makes toenail changes particularly valuable as health indicators is their visibility. They provide a window into your circulatory and immune health that's easy to monitor without special equipment. If you notice concerning changes in your toenails, a podiatrist or primary care physician can evaluate them. Diagnostic approaches may include visual examination, nail samples to check for fungal infections, or blood tests to assess for underlying conditions. Treatment depends on the cause, but may include oral or topical antifungal medications for fungal infections, nutritional supplements for deficiency-related changes, improved foot care practices and appropriate footwear, treatment of underlying systemic conditions. Is this information surprising to you? Let me know in the comments if you've ever had your toenails checked during a medical exam. Many doctors overlook this important assessment. Remember, healthy nails should be relatively smooth, consistent in color, and not overly thick or brittle. Regular inspection of your toenails could reveal important clues about your overall health that shouldn't be ignored. The fifth critical foot change to monitor after age 70 is increasing joint pain or stiffness in your feet. While many assume foot pain is simply part of getting older, persistent or severe joint discomfort often signals serious health conditions requiring treatment. Consider Arthur's experience. At 78, he began experiencing stiffness and pain in his toe joints, particularly in the mornings. Assuming it was just arthritis, he delayed seeing a doctor for months. When he finally sought medical attention, blood tests revealed he had gout and significantly elevated uric acid levels, which put him at increased risk for kidney disease. With proper medication and dietary changes, his pain subsided and his kidney function stabilized. Have you experienced increasing joint pain or stiffness in your feet as you've aged? Many people suffer unnecessarily, not realizing effective treatments exist. Share your experience in the comments section. Here's why foot joint pain deserves attention. Your feet contain 33 joints each, and problems with these joints can signal whole-body inflammation, autoimmune conditions, or metabolic disorders that require treatment to prevent progressive damage. The most common causes of joint pain and stiffness in the feet after 70 include 1. Osteoarthritis. The cartilage between joints wears down over time, allowing bones to rub together painfully. 1. Rheumatoid arthritis. This autoimmune condition causes the body to attack its own joint tissues. 1. Gout. This painful type of inflammatory arthritis results from elevated uric acid levels forming sharp crystal deposits in joints, commonly affecting the big toe first. 1. Psoriatic arthritis. Often accompanying the skin condition psoriasis, this inflammatory condition can damage joints and tissues throughout the body if not treated. 1. Reactive arthritis. Sometimes following an infection, this condition causes joint inflammation that can become chronic without proper treatment. What makes joint pain particularly concerning is that effective treatments exist for most causes, yet many seniors suffer unnecessarily, attributing the pain to normal aging that must be endured. Warning signs that your foot joint pain requires medical attention include morning stiffness lasting more than 30 minutes, joints that appear red, hot or swollen, pain that wakes you from sleep, rapidly increasing pain or sudden inability to bear weight, joint pain accompanied by unexplained fatigue or weight loss. Diagnostic approaches may include physical examination, blood tests for inflammatory markers or specific conditions, imaging studies, and sometimes joint fluid analysis to determine the exact cause. Treatment options vary by condition but may include anti-inflammatory medications, disease-modifying drugs for autoimmune conditions, physical therapy to maintain joint function, dietary modifications, particularly for conditions like gout, specialized footwear or orthotics to reduce joint stress. And remember, joint pain is not simply an inevitable part of aging to be endured. It's often a treatable condition that, when addressed properly, can significantly improve your mobility, independence, and quality of life. The sixth dangerous foot change to watch for after 70 is the appearance of wounds or ulcers that heal slowly or not at all. This seemingly minor issue can rapidly escalate into life-threatening complications if not addressed promptly. Let me tell you about Catherine, a 77-year-old with a small blister on her heel that she noticed after wearing new shoes. Because it wasn't painful, she simply covered it with a bandage. 2 weeks later, when the area had darkened and expanded rather than healing, her daughter insisted on a doctor's visit. The diagnosis was sobering. Catherine had developed a diabetic foot ulcer, and blood tests revealed she had undiagnosed type 2 diabetes. With immediate treatment, the wound eventually healed, but her doctor explained that without intervention, she could have faced amputation. Have you or someone you know ever experienced a cut or sore on your feet that seemed to take forever to heal? Please share your experience in the comments. Your story might help someone else recognize this warning sign. Non-healing wounds are particularly dangerous because they provide an entry point for infection into the body. For seniors with compromised immune systems or circulatory issues, these infections can rapidly spread and become life-threatening. Here's why non-healing wounds, deserve immediate medical attention. They often signal undiagnosed diabetes. Elevated blood sugar damages blood vessels and nerves, impairing circulation and sensation. Up to 25% of people with diabetes will develop a foot ulcer in their lifetime, and these ulcers precede 85% of diabetes-related amputations. They indicate serious circulation problems. Wounds need adequate blood flow to heal. Persistent wounds often mean arterial disease is preventing oxygen and nutrients from reaching the tissue. This same process that prevents wound healing can lead to heart attacks and strokes elsewhere in the body. They can rapidly deteriorate. What begins as a small wound can quickly become infected, with the infection potentially spreading to bone, osteomyelitis, or entering the bloodstream, sepsis. These complications can become life-threatening in a matter of days. Warning signs that a foot wound requires immediate medical attention include any wound that hasn't shown significant improvement within 2 weeks, wounds with redness extending beyond the immediate area, darkening tissue around the wound, wounds with an unusual odor, any drainage, especially yellowish or greenish, fever or chills when you have an open wound. The diagnosis process typically includes evaluation of the wound, circulation testing, nerve function assessment, and often blood tests to check for conditions like diabetes or infections. Treatment approaches depend on the underlying cause but may include specialized wound care and dressings, debridement, removal of dead tissue, infection control with antibiotics, offloading pressure from the wound area, treatments to improve circulation, and blood sugar management for diabetic wounds. Perhaps most critically, prevention becomes essential once you've experienced a non-healing wound. This includes daily foot inspection, proper footwear, moisture management, and regular professional foot examinations. Remember, in healthy individuals, minor wounds should show signs of healing within days and be well on their way to resolution within 2 weeks. Any wound that lingers beyond this time frame is sending you an urgent message about your health that shouldn't be ignored. The seventh critical foot change to monitor after 70 is something most physicians rarely discuss with their patients. Changes in hair growth patterns on the feet and lower legs. This subtle sign can provide crucial early warning of vascular problems that might otherwise go undetected until they become dangerous. Consider William's story. At 82, he noticed the hair on his right foot and lower leg had completely disappeared, while his left leg maintained normal hair growth. When he mentioned this casually to his cardiologist, it prompted immediate vascular testing that revealed a 90% blockage in the artery supplying his right leg. The intervention that followed likely prevented a future amputation and identified coronary artery disease requiring treatment. Have you noticed changes in hair growth on your feet or legs as you've aged? This often overlooked sign could be significant. Share your observations in the comments below. Hair growth on our feet and lower legs depends on adequate blood flow to the hair follicles. When circulation becomes compromised, hair follicles are among the first structures to show the effects, making changes in hair growth patterns an early warning sign of vascular insufficiency. Here's what makes changes in foot and leg hair particularly valuable as a diagnostic sign. It's often asymmetrical. Unlike the general hair thinning that comes with aging, vascular-related hair loss typically affects one limb more than the other, corresponding to areas with reduced blood flow. It's gradual, but observable. The change typically occurs over months, making it noticeable if you're attentive to your body. It's an early warning. Hair loss often precedes more serious symptoms of vascular disease like pain, ulceration, or discoloration by months or even years. It's objective. Unlike subjective symptoms such as fatigue or mild pain, hair growth changes provide visual evidence that can be tracked over time. The primary condition signaled by changing hair growth patterns is peripheral arterial disease, PAD, which affects approximately 20% of adults over 70. PAD not only threatens limb health, but indicates atherosclerosis that likely affects arteries throughout the body, including those supplying the heart and brain. Other signs often accompanying hair growth changes include skin becoming thin, shiny, or tight over the affected area, decreased temperature in the affected limb, weakened pulse in the foot or ankle, slower nail growth on the affected side, increased time for color to return after pressing on the skin. Diagnosis typically involves non-invasive vascular testing such as ankle brachial index (ABI) measurement, which compares blood pressure in the arms and ankles to detect flow restrictions. More detailed assessment may include ultrasound, Connecticut angiography or MRI. Treatment approaches focus on addressing the underlying vascular disease and may include medications to improve blood flow or prevent clotting. Lifestyle modifications, particularly smoking cessation, supervised exercise programs to develop collateral circulation, interventional procedures to open blocked arteries, surgical bypass in severe cases. Remember, the hair on your feet is doing more than just growing. It's communicating important information about your vascular health. Taking a moment to observe changes in hair growth patterns could provide early warning of problems that, when caught early, are much more successfully treated. After learning about these 7 critical foot changes, you might be wondering, what difference does early detection really make? Let me share Howard's complete story to show you the transformative power of recognizing these warning signs. After Howard's near amputation experience with peripheral arterial disease, he became vigilant about monitoring his feet daily. 6 months into this new routine, he noticed unusual swelling in his right foot, along with subtle color changes. Instead of dismissing these signs, he immediately contacted his doctor. Tests revealed Howard had developed atrial fibrillation, an irregular heart rhythm that was causing blood to pool and creating the swelling. This condition significantly increased his stroke risk. Because of his prompt action, Howard's doctors were able to start appropriate treatment before he experienced any complications. Today, at 75, Howard walks 3 miles daily, travels with his grandchildren, and volunteers teaching others about foot health. He often says, "My feet saved my life twice. First by warning me about arterial disease, and then by alerting me to a heart condition that could have caused a stroke." The simple truth is this: your feet can reveal problems throughout your body, often before other symptoms appear. By monitoring the 7 changes we've discussed today, you're not just protecting your feet, you're potentially saving your life. Has this video changed how you think about foot health? Will you start checking your feet more regularly? Share your thoughts in the comments below. Remember, these warning signs are especially critical after 70, when circulation, nerve function and healing capacity naturally decline. Regular foot checks should become as routine as brushing your teeth. If you've gained valuable insights from today's video, please take a moment to hit that like button and subscribe to our channel for more potentially life-saving health information for seniors. Share this video with loved ones over 70. This knowledge could be the difference between early intervention and serious complications. Remember to check your feet daily for the 7 warning signs we've discussed, and don't hesitate to seek medical attention if you notice concerning changes. Thank you for joining me today on Life Advice for Older People, where we believe that knowledge is power, especially when it comes to your health.